Emma, these are numbers. What do they mean to you?
To me, this is another example of just how fast Omicron is spreading. We have known from other countries like South Africa that this could move quickly, but I think we're really seeing that exemplified in the recent numbers from the UK and Italy. And it's a reminder that the real threat here is to the hospitalization and to our healthcare systems. With case numbers like this before the vaccine, we would be in big trouble. The good news is with the vaccine, even against Omicron, we have some protection against those severe outcomes. But if a lot of people get this at the same time, even if only a small number of those need hospitalization, we risk overwhelming our healthcare systems.
How big a threat is that? The British papers are taking a much more positive view today in terms of their perception. The Times of London, it's a storm, not a hurricane, say scientists. Would you agree with that?
So I think some of this comes from recent reports that suggest that Omicron may be less severe than Delta. But there's a couple of really important factors here why we don't want to celebrate too early. First, some of this is probably coming from vaccine protection. And so that means that even people that are vaccinated, they might be getting infected now with Omicron, but they're not ending up needing as much hospital care or perhaps to go to hospital at all. Unfortunately, for unvaccinated people, they could still be at serious risk. So we need to remember that this may not be milder in them. And then the last thing is that, as I said, even if it's milder, even if fewer people need to go to hospital as a percentage, if hundreds of thousands of people get this at the same time, and a lot of healthcare workers are out right now because they have Omicron, we could come to a point where we simply can't give everyone the care that they need. And of course, that's even before we consider normal emergency care and routine procedures that are having to be delayed once again. So I think at this point, it's really about flattening that curve so that we don't end up with more people needing care than we can care for.
With the direction of travel here, what does this mean for January when more people start to return to their offices?
I do think this is something that it's really important governments keep in mind. At the moment, many places, especially in Europe, have introduced more restrictions. But Christmas itself and the holiday period is a bit of a strange time. Yes, we meet up with family and maybe a few friends, but a lot of people will be careful. They might spread things to some relatives, but it might also be contained in that family circle. Now, things will change in January if people start going back to work. Some countries still have work from home, others won't. But it's important to remember that it's those more normal routines, those interactions in the workplace, meetings up after work, those are potentially the bigger problem for transmission. So countries need to remember, even if we see a delay or a plateau in cases over Christmas thanks to restrictions, we need to be really careful that as people go back to the office and back to their normal routines, we could see an uptick in cases again.
Emma, do we know how many of the people that are currently in hospital have Omicron and how many have Delta? And I'm wondering if once we get through Omicron, Delta almost comes back. The curves look very different. The Omicron curve looks very steep and potentially could come down quite quickly. Delta obviously has been something that's been around for a lot longer. The curve looks flatter, but potentially more dangerous. Does Delta come back once Omicron has passed?
So this is an interesting question. We don't yet know whether if you have Omicron, what kind of protection that might leave you with against Delta, for example. But certainly we know that the vaccines protect you against hospitalization for both. Now, one thing I think is really important to keep in mind here is what the German health minister said last year. And he said quite bluntly that after this winter, people will either be vaccinated, recovered, or dead. Now, that was before Omicron, but I think Omicron is making this point even a little bit more starkly, because it transmits so quickly that if you aren't vaccinated, there's a very good chance you'll get it. Hopefully you will recover and not have any severe outcomes, not need hospitalization. But it will mean, I think, that when we come out the other end of this, we will have a higher level of population level immunity. Of course, I highly recommend you get that through a vaccine, but for those who haven't, they might well get it through infection this winter. Now, I don't think that's the best way we could get to this level, but it could leave us better prepared for other variants and even Delta in the future.
Well, that's what I was going to ask. We only really have 30 seconds or so left here, Emma. How worried are you about the future variants given how quickly Omicron is spreading?
I think we have to remain prepared that we don't know what other tricks SARS-CoV-2 could have up its sleeve. Viruses will always continue to mutate. Hopefully this was the last big set that Omicron could come up with, but we don't know that there might not be another one. So it's really important we prepare for a future where we're ready if there's another variant in the future, we can get boosters and vaccines out there quickly and make sure our healthcare systems won't be overwhelmed.